Prolonging life at all costs causes suffering. This might be a controversial or unpopular opinion, but how much medical intervention is too much? When is enough enough? In this video, I'm going to discuss the type of patient who usually has a chronic or terminal illness, and the people around them or the patient themselves starts asking themselves, when is it time for hospice? You know, they're usually going in and out of the hospital, in and out, in and out. When is enough enough? That's what I'm going to answer in this video. As a hospice nurse, former ICU nurse, you know I have an opinion about this. I do feel like Western medicine has done many wonderful things for our lives and has helped us all live longer. But I have seen firsthand that sometimes, not sometimes, all the time, prolonging life at all costs causes suffering. And we need to get better at knowing when is enough enough. So let me give you some scenarios, let me paint you some pictures and help you see when to start thinking about hospice or end of life in general. Common thing I often see, specifically with chronically terminally ill patients, meaning like anyone with a disease like congestive heart failure, COPD, chronic kidney disease, ALS, some kind of advanced cancer that they've been living with for many, many years, right? But it's starting to get towards the end. How do we know this? We know this with any kind of chronic, terminally ill patient because you'll start seeing them not bounce back as quickly after they get out of the hospital. You'll start seeing that at least once a month they are in the hospital, right? Or maybe a few times a month, boom, hospital. Then they get a little better, back home. Then boom, something happens again, back in the hospital, back, forth, back, forth, back, forth. At first, their body might be able to handle this, and they really do bounce back and get better. And they have long stretches out of the hospital. But most of the time, when it's getting towards the end of life, which we all get there, you'll start seeing that they don't bounce back as quickly. That they end up back in the hospital again and again and again and again. Each time maybe worse. Each time maybe they're staying longer. Maybe even they go to the hospital and they don't do anything because there's nothing to do. Their body has reached the max, right? If you're listening to this video and you're like, whoa, that sounds like me, or whoa, that sounds like my loved one,